But we begin in the UK, where the results of late-stage trials by British-Swedish drug maker AstraZeneca and the University of Oxford show that their vaccine could be up to 90% effective. Now, the vaccine is said to be cheaper, as well as easier to store and distribute compared to competitors. Now, Pfizer and Moderna had reported promising results from their vaccine trials. The British government has pre-ordered 100 million doses of the Oxford vaccine and said it plans to make the COVID-19 vaccine widely available by next spring.
We've got a vaccine which is highly effective. It prevents severe disease and hospitalization. And intriguingly in the results, although the headline is 70% protection, we do have a subgroup who got a half dose as the first dose and then a full dose as the second dose, where we saw 90% protection. So I think these are really exciting results. And because the vaccine can be stored at fridge temperatures, it can be distributed around the world.
Well, for more, our health correspondent Nicola Hill joins us live from London. We're also joined by Dr. Bharat Pankania. He's a senior clinical lecturer at the University of Exeter Medical School. Nicola, let me start with you. We've had, encouraging bits of news in the last couple of months, but just how promising is this?
Oh, I think it's really promising news, and it's one that we've been waiting for. We'd obviously heard from Moderna, we'd heard from Pfizer-BioNTech, and now Oxford have given their results. And basically, this is based on about 24,000 volunteers here in the UK, in Brazil and in South Africa. And out of those, 131 contracted COVID-19, 101 in the placebo group, in fact they were given a meningitis vaccine, and 30 in the vaccinated group. Now, as we just heard Professor Pollard say there, it was the group who were given a half dose and then a full dose who actually did best. They got a 90% efficacy rate. And he had a press conference this morning with him, with Professor Sarah Gilbert, and with everybody from AstraZeneca, answering questions from us journalists. And he explained there why he thinks this half dose actually was more effective.
In terms of what's going on with the immune response, we think that by giving a smaller first dose, that we're priming the immune system differently. We're setting it up better to respond. And what we don't know at this moment is whether that difference is in the quality or the quantity of the immune response. And that's something we're going to be digging into over the next weeks. And we've already started some work this morning to try to answer some of those questions, having only seen these results in detail over the weekend.
And that's typical of the Oxford team. I mean, they've been working 24/7 since April to get their vaccine up underway. And it is different from the Moderna and the Pfizer vaccines because it's not the novel technology. This is based on established vaccine technology, based on one that they developed against MERS. And what's really interesting as well is that we asked them this morning how long their vaccine was going to work for, which is the thing that we all want to know. And Professor Sarah Gilbert said that the people who've been given the MERS vaccine still had antibodies a year later. So that's important because if this vaccine's as durable as that one, it means it's going to last for a long time. We also know that those who did actually contract COVID-19 didn't have the severe form of the virus, they weren't hospitalised. And we know from the results we had last week that it's also effective. It helps boost the immune system in the elderly, which of course is vitally important. But Andrea, as you said at the very beginning there, what's also so important about this vaccine is that they're making it on a not-for-profit basis, and they've already started manufacturing, as many of them did, once they started developing the vaccine. So apparently there will be 3 billion doses available worldwide by the end of next year, and it can easily be transported around because it doesn't have to be frozen, it doesn't have to be stored at -70 like those other two vaccines, it can be refrigerated. So that's the benefit once they determine, and they say they're going to do lots more studying of the data to work out whether this half dose then a full dose is the best way forward.
Okay, Nicola, thank you so much for that. I mean, it really does sound promising, to say the least, when you put it in that context. Thanks so much. Let me turn to Dr. Bharat Pankania now. Doctor, let me ask you, I mean, as a doctor, though, like I said, it is reassuring to hear, our reporters say just how solid these trials really were and how encouraging all the evidence is pointing to the efficacy of these vaccines. But how do you get people, your patients, to trust this? Because many are going to say it was rushed. I want to see what happens before I take it, and they may want to even wait years.
Well, we take our patients with us. So what have I done in the past? When I had my population in the southwest region of England, there was a community who were anxious about the mumps, measles, rubella vaccine. I went to the community. I talked to them. I informed them. I addressed their concerns. I told them the benefits of being immunized. I told them the costs of having the infection, how serious the infection was. And there was no pressure. There was no hard sell. But once you arrive as the honest person who wants to help people, you can take them with you. Admittedly, some people we will never convince. In the middle of the pandemic, the strategy to follow is we give to the people who are willing takers. And then we will address the issue with people who are concerned and don't want to take. But in the first instance, there will be many takers, and we should focus on that.
Right. We just have to hope there are at least some efforts being made to mobilize doctors like you to start getting out there and gaining the public trust in understanding how this vaccine works and how important it is that people do take it, especially if they're at risk. So if they aren't, though, if they aren't willing to take it in big enough numbers, what happens to the virus?
Well, every immunization effort is a step in the right direction. I have no evidence to say to myself that a large majority will not take it. So my concerns are not about people refusing to take it. My concerns are how quickly can I immunize a large number of people? And there is two schools of thought, and there's two operations that we should undertake simultaneously. One, we immunize the people who are very vulnerable. In case they get infected, they could get severe illness and die. Two, we also immunize healthcare workers, because invariably the healthcare workers can infect their patients in a hospital setting. And then, of course, there's another box to think about, which is the greatest gain for your dollar. There, what I'm referring to is if you were to extensively, very quickly, very efficiently immunize a large number of people from the 20 to 50 age group, the most mobile, the most people who are out and about, what happens there is you manage to reduce the number of virus activity in the community. And that also has a percolating effect of protecting the more vulnerable people who have yet not got the vaccine. So those are the facets, those are the strategies to adopt.
Okay. Final question for you. I mean, there are 4 viable vaccines pretty close to reaching the market now. Tell me how you view the advantages and disadvantages, if there are any, of having that kind of competition and that kind of variety among the vaccines that could be available in the coming months.
For me, it's an easy choice because I'm a public health doctor, and the greatest good for the greatest number of people is my choice. So if I can immunize a large number of the world's population, that's the option I wish to adopt. So I'm very happy that the AstraZeneca vaccine, which is easy to transport, easy to store, easy to give, has been showing successful results. So I go with what will be successful and easy to deliver. At the moment, the AstraZeneca one is one of those easier to deliver vaccines. That is not to say that the Pfizer and the Moderna ones are not good. That's not what I'm saying. What I am saying is globally, the easier one is better. And in a rich country like the United States, where they might have sophisticated refrigeration systems, etc., it's perfectly okay to use the Moderna one and the Pfizer vaccines.
Dr. Pankania, thank you so much for joining us as always. We really appreciate it.